Thank you. You guys ready? Yeah? Okay. Good afternoon, everyone. I'm Mayor Paula Guajardo, and thank you for joining us this afternoon. Today, we're hosting the news briefing to update residents on COVID-19 in our community. I want to remind our listeners and viewers today that we have powerful tools to fight against COVID-19 and its variants. We have tools such as testing for all ages, vaccines for ages 5 and up, and booster shots for ages 16 and up. Just Monday, January the 3rd, the U.S. Food and Drug Administration authorized the use of a third dose of the Pfizer vaccine for children ages 12 to 15 years. So I want to urge everyone to please follow CDC guidelines to help prevent contracting COVID and its variants, because this helps stop new variants from arising in the community. Health experts are urging residents to be vigilant, and the CDC and the World Health Organization continue to remind us to follow their guidelines, which include vaccinations, regular testing, social distancing, and frequent hand washing, and most especially to please stay home when you're sick. And as these are all effective ways to combat the virus from spreading. Anything that you can do to help keep yourself and your loved ones out of the hospitals is absolutely critical. Please keep in mind that many experts are also recommending that children age 5 and up get vaccinated, and if eligible, get a booster shot. Vaccines have played a remarkable role in reducing the number of hospitalizations and severe reactions to the disease. And this is directly from the State Department of Health Services, the Commissioner John Hellerstedt. And as your mayor, I want to encourage everyone who wants to get vaccinated to please do so. And I'd like to remind the community that COVID-19 vaccines are readily available throughout the city, as they have been. And of course, our team stands by to assist you. But for more information on these locations, I would ask that you please visit cctexas.com/clinics. We must work together, as we've been saying, to ensure public health for all. And remember that we can help stop this pattern by increasing the vaccination rate in our community. So if you were vaccinated over 6 months ago, get your third dose or your booster. If you've received the Pfizer vaccine, you can get your booster after 5 months instead of waiting 6 months. We can each do our part following CDC guidelines so that we can keep our entire city safe. And I encourage you to do so. Lastly, I want to thank all of our residents who have made the decision to get vaccinated. 80% of our residents ages 65 and over have been fully vaccinated. 68.6% of residents ages 16 and over have been fully vaccinated. Our health department on its own has administered over 190,000 vaccines to date. So Corpus Christi, we know what works. You know what to do. Get fully vaccinated, get your boosters, make good decisions, and let's help keep Corpus Christi healthy. Thank you. And now I believe we'll hear from our County Judge, Barbara Canales. Gabby, I'm sorry, after the translation.
Mm-hmm. Quiero recordarles que contamos con muchas herramientas para la prevención en contra del COVID, comenzando con las pruebas de detección y vacunas para todas las edades, vacunas para mayores de 5 años y vacunas de refuerzo para mayores de 16 años. La FDA autorizó el uso de una tercera dosis de la vacuna Pfizer para niños de 12 a 15 años. Le pido a todos los residentes seguir las pautas de los CDC para prevenir contagios, ya que también evitará otras variantes, y sobre todo seguir las sugerencias de salud como distanciamiento social, el lavarse las manos con frecuencia y quedarse en casa cuando está enfermo. Los expertos recomiendan que los niños de 5 años en adelante se vacunen y, si son elegibles, reciban una vacuna de refuerzo. Las vacunas COVID-19 están disponibles en toda la ciudad y que nuestro equipo está listo también para ayudarlo. Para obtener más información sobre estas ubicaciones, visite www.cctexas.com/clinics. Si fue vacunado hace más de 6 meses, obtenga su tercera dosis o refuerzo. Si recibió la vacuna Pfizer, puede recibir su refuerzo después de 5 meses en lugar de esperar 6 meses. 80% de nuestros residentes mayores de 65 años han sido vacunados completamente. 68.6% de los residentes mayores de 16 años han sido vacunados completamente. Nuestro Distrito de Salud ha administrado 190,622 vacunas hasta la fecha. Sabemos qué funciona y qué hacer. Vacúnese completamente, reciba su refuerzo y tome buenas decisiones y mantengamos a Corpus Christi saludable.
Hi, good afternoon. Annette Rodriguez, Health Director for the city and the county of Nueces. So I wanted to start out by telling you that we do have confirmation of 3 cases of the Omicron variant, the B11529, that we received today. The patients are 3 males, 2 between the ages of 20 and 30, and 1 between the age of 60 and 70. One of the patients is currently fully recovered and is back at work. The other 2 patients are pending follow-up investigation. The patients were all fully vaccinated with their primary series when they became ill in December. None of the individuals had received their booster shot. They were tested and found to be a breakthrough case, and the specimens were sent off for genomic testing to determine that they had the Omicron variant. According to the U.S. CDC, this variant is classified as a variant of concern by the World Health Organization because there were data indicating an increase in infections in South Africa. While the Omicron variant is relatively new, CDC emphasizes that current vaccines, the Pfizer, the Moderna, and Johnson & Johnson, still provide protection against infection by the Omicron variant, especially for those that receive their booster dose. Breakthrough infections of these vaccinated are possible, but symptoms have generally been milder and hospitalizations less frequent to those not vaccinated. It typically takes 2 weeks after vaccination to get your body to build up immunity against the virus. You are not fully vaccinated until those 2 weeks have passed. Residents are highly encouraged to get fully vaccinated and to get boosted as well. As the mayor said, you may now get your booster, your Pfizer booster early. Instead of 6 months, you can get it at 5 months. Moderna is still 6 months after your primary series, and Johnson & Johnson is 2 months after your initial Johnson & Johnson dose. I'm now going to turn it over to the COVID statistics. So again, Omicron is here in Nueces County, and we have 3 confirmed positive cases. We already knew this, but we didn't have a paper in our hand, and now we do. So everybody knows. Next slide. This one's really interesting because if you look at, everybody knows that we had these wave, of COVID-19 cases, and the first wave was back in the summer of 2020. And that was in July, where we had almost 10,000 cases at that time. And then we had the small winter peak over December and January, going down in February. And then in 2021, we had our second summer peak, and we had almost 12,000 cases. So now the numbers went back down. But if you look at December, for the whole month of December, we had 2,014 cases of COVID-19 here in Nueces County. But if you look at January, for the last 4 days, or the first 4 days in January of 2022, we've exceeded the number of cases that we had for the whole month of December, with 2,127 COVID cases in 4 days. Next slide. The age ranges are important as well, and I bring them to the community today because I wanted to make sure that everybody knew. Yesterday we had 960 positive cases, and the age ranges are here as we're showing. But what's important to me, what I look at, is those that are the pediatric age. So 18 years and younger, you see from 0 to 9, 61 positive COVID cases, and from 10 to 18, you see 109. So a total of 170 of the 960 positive cases yesterday were in the pediatric population. I want you to keep an eye on that because you're going to continue to see that number increase, now that we're back to school and kids bring that COVID home and then they give it to their siblings. And so watch that number. Today, that number was over 200. with the 600 positive cases that we had today. Next slide. These are the weekly cases. So you see, from August to the present, you see this slope. And so the cases are clearly going back up. What's interesting, again, is if you look at the week of December 27th through January the 2nd, you're going to see 1,373 cases. That's in 1 week. Normally in a week's time, we have around 300 cases. So we saw 1,373. If you look at for the next 2 days, we have already 1,000, almost 400 cases of COVID positive individuals here in Nueces County. Next slide. So for the deaths, the good news is that we have currently 1 death here. I believe we have 2. I think we had 1 today. And our hearts go out to the families that lost individuals to COVID-19, even the ones from January, from this new year. Next slide. These are the hospitalizations, and what's important here is if you look at December 24th, Christmas Eve, you see that we had 25 people in the hospital fighting with COVID-19 infections. And if you look at the last one from yesterday, from January the 4th, we have 78 individuals hospitalized here in Nueces County with COVID-19. So I think that's really important that you kind of keep an eye on that, because I know that we're all hearing that it's not as serious, but there are still people that are having to be hospitalized with the new Omicron variant. So we need to make sure that we're using all of our precautions available. The next slide is on flu. And the reason I bring up flu is because if you look at last year, and that's the blue line at the bottom, and you look at this year with the red line, you can see that we have flu activity here in Nueces County. And so if you look at the last week of December, you're going to see that we were at 111 people with influenza-like illness, which means that they didn't know what they had. They had some kind of respiratory infection going on with some fever, and so they got tested, and so those are those individuals. And that compared to 12 the previous year. So 12 cases of people that thought they had the flu versus 111. The next slide is going to show you actual people that they did a flu test on them and they came back positive. If you look at the red line, that's from last year, so our numbers were very low last year with flu cases. If you look at the blue line, that's this year, and you're starting to see that rapid increase of influenza-like illness, but this is actually positive flu. So they actually got a test, they got a rapid test, and it came back positive. And so the last week of December, 269 people were tested positive for flu last year, and this year, 762 people were tested positive for flu. And I bring that up because I think it's very important that everybody understands that you can still get a flu shot. It's important to get your flu shot so that way you have that protection against the flu. You can get it at the exact same time that you get your COVID-19 vaccine. And it's important because if you do get really sick with COVID-19, you don't want to be in the emergency room and you don't want to waste time while the physician's trying to figure out, do they have flu? Do they have Omicron? What do they have? And so if you have your flu shot, you can tell them that you had your flu shot, and so they can probably rule that out very quickly. Next slide. So Omicron has swept across the nation, and it now accounts for over 95% of all of our genosequence specimens in Texas. So as of January 4th, 960 people tested positive with COVID-19 in Nueces County. 960 people tested positive yesterday, compared to we normally have around 40, 50 people test positive a day. This was almost 1,000 people that tested positive in one day. The most cases ever that we've had since the beginning of the pandemic. The variant is highly transmissible. We've seen a dramatic increase, and Dr. Bird will talk more about this. We're averaging 65 cases per day in December, and now we're up to 532 cases per day in the first 4 days of January. As the Omicron variant spreads, more children are ending up in the hospital. During Christmas week, there was a 66% increase in children admitted to the hospital from the previous week. Next slide. So this slide basically shows the new CDC guidelines. So, CDC updates every time they have new information, there's new data that they can actually take from and they can make these decisions. And we know because Omicron is so transmissible, we know that 10 days, 14 days, if you did that, everybody would be at home in isolation or in quarantine, and so you wouldn't be able to get gas, you wouldn't be able to get groceries, you wouldn't be able to get to your job because you didn't have gas in your car and you just couldn't get there. And so they've changed their guidelines just recently. And so this is what the guidelines are now. If you've tested positive for COVID-19, you must isolate for 5 days. If symptoms have resolved after 5 days, you may leave your home, but you must continue to wear a mask for the additional 5 days. And when they say wear a mask, they mean a properly fitted mask over your nose and mouth. If you did not test positive for COVID-19, you can return back to work or school, continue normal activities. So now we're going to go to the other side. If you've been exposed to somebody with COVID-19, so I'm not positive, but my friend was, and I was there visiting with her. What do? If you are fully vaccinated with your primary series, which means for Moderna and Pfizer, you have the 2 vaccines, or for the J&J, you have the 1, and you've been boosted, the only thing you have to do is wear a mask around anybody, whether it's co-workers, family, anybody. You must wear a mask for 10 days. They also ask that you test on day 5 to see if you've actually picked up that infection. If you are not boosted, or you're not vaccinated, or you've only had 1 vaccine, whatever the other category is, so the only one that we just talked about was you've had your complete primary series plus your booster. This one is, I haven't had my booster yet. This is what you have to do. You have to stay home for 5 days, and you must wear a mask for an additional 5 days. That is if you're asymptomatic on day 5. Asymptomatic doesn't mean I just have a little headache, or I have a little cold, or I have a little cough. It doesn't mean that. Asymptomatic means you don't have symptoms. So on day 5, if you don't have a fever, you're improving in your symptoms, you feel better, on day 6 you can go back to work, but you must continue to wear a mask for the complete 10 days anytime you're around people. The other thing that I want to say on this one is that when you're around family members and you're positive, you need to go back to what we were doing in 2020, and you need to completely isolate yourself from your other family members. So you need to stay in a room to yourself, let your family pamper you, let them take food to you, so that way you do not infect others. So stay in one room. That's the best way to do it. It's only 5 days. So I think we can all handle it for 5 days. You have your cell phones with you, so you should be fine. You should not share a bathroom if at all possible. You should have your own bathroom. So we like to tell people, let them have the master bedroom if possible. Don't share utensils with other family members. Do everything in your power to keep other people from getting the virus. Next slide. The total vaccines administered, and I know the mayor said this earlier, but here's the slide that shows that for the health department. There's other people that give vaccines in Nueces County. We are not the only ones. But what we've given is a total of 196,602. Johnson & Johnson, 9,000. Moderna, 142,000. Pfizer, adult and pediatric doses, around 45,000. Next slide. This slide actually shows how many boosters have been administered, 24,272, not very many boosters. If you think about the population of Nueces County, these are the individuals that have the most protection against Omicron. There's a lot of other individuals that don't. So that's why we're seeing high positivity rates right now with people going through our drive-through. Next slide. So how many people actually are fully vaccinated in Nueces County? 54.2. If you look at the whole population, and that's how you should be looking at statistics, but everybody shows different numbers, so 54.2. If you look at for those aged 65 years and older, we're at 80% fully vaccinated. So we've done a really good job with the elderly, and we need to continue to improve with our younger populations. And we also realize that the younger populations just more recently were eligible to get vaccinated. So where can you get vaccinated? So we're trying to stay consistent at the same locations so that way people can remember where we're at when they need to get a vaccine or when they have family members here. La Palmera Mall, at the Greenwood Senior Center, at the Robstown Outlet Mall, at the old Nike store, at Physicians West, at the Nueces County Courthouse, and City Hall. We also have some off-site clinics on Mondays, the QSR Legacy from 11 to 6. On Tuesday and Thursdays, we're at the Goodwill Clearance Store on Ayers from 10 to 5. And on Wednesdays, we're at the FIAS parking lot. And we've had to alter that time, the closing hour a little bit because it's getting dark much quicker. For the COVID vaccination testing, testing is being conducted at the Old Memorial Hospital between 9 a.m. and 6 p.m. all week, and we've even included Saturday because we know how many people are needing to get tested right now. That means that there's a lot of illness in the community, and that means everybody needs to be using their precautions. We're also going to augment what we do at Memorial by having another drive-through tomorrow at the Richard Borchard Fairgrounds between 9 a.m. and 6 p.m. So if you're in that area, you're welcome to come over to get tested. What about the monoclonals? So we're getting a lot of phone calls at the health department asking us about monoclonals. They heard about there's this treatment that you can use if you get COVID-19. That was for the Delta variant. So for the Delta, Regeneron was being used, but it's been proven ineffective against the Omicron variant. So that's all on hold right now. The monoclonal specifically for Omicron is Sotrivimab, and it has been approved. The only problem is it is very limited in supply, and so the state is telling us that we should be getting some here to our community around mid-January to the end of January. There's also treatment. There's Merck and Pfizer have COVID-19 pills, but you need a prescription. So you have to go to your doctor's office, and you need to make sure that you get a prescription for that, and then CVS and Walgreens has some limited supplies of that as well. Next slide. So on Tuesday, CDC recommended shortening the interval of time between when people who had their initial series of Pfizer vaccinations and when they received a Pfizer booster from 6 months to 5 months. So I'm hoping everybody's heard that. So if you have children that are 12 years and older, but it's not just for children, it's for anybody 12 years and older, and they're needing a booster shot, that you don't have to wait the 6 months. Now you can get it at 5. If they've gotten, if you have people, family members that have gotten Moderna, they do need to wait the 6 months. That's still 6 months. And for people with Johnson & Johnson, it's 2 months. The CDC is also recommending that children ages 5 to 11 with moderate or severely weakened immune systems receive an additional dose 28 days after their second Pfizer shot. So you get 1 dose, and then 21 days later, you get your second dose, and you have a really immunocompromised individual. They've just recently had a bone marrow transplant. Whatever that issue is, they should get a third shot 28 days later after their second. And finally, the FDA also approved Pfizer booster shots, and we talked a little bit about that, and it's as early as 5 months after their second primary series. So some really important reminders that I thought I needed to bring up. So, and one of them is we're asking that, we're seeing a lot of traffic at the health district. People are wanting to come in to get their vaccine, or they're wanting to ask about where do I get tested, or can I get my vaccine here? So we're asking that you call the health district instead of coming in, especially for those individuals that are wanting to get tested, because if you're wanting to get tested, that means that you're probably have symptoms and you may really have COVID-19. And so we're asking that you call. But don't just do that for the health department. You should do that even for your private physician. If you have a primary care physician and you know that you were exposed and you think you have COVID-19, you should be calling them before you go over there. So that way it's a courtesy to them so they know, oh, they were exposed to COVID-19, they may have the virus, we need to take all these precautions. The other thing is do not go into the mall or to the Greenwood Center or to the Nike store if you're looking to get tested. Again, if you're looking to get tested, you're probably sick. And these other places that I've mentioned, the La Palmera Mall, these are strictly for vaccination. So these are for healthy individuals. They're not sick. They're trying to get vaccinated. So please don't go in there asking, can I get tested? Do y'all do swabbing here? Because that's not where we do it. We do it at the Old Memorial Hospital, and we're doing it all day long to meet the demand of people that are wanting to get tested currently. If you need your vaccination card, again, please contact us at the 826-7200. We ask that you not walk in because Omicron is highly transmissible. That's all I have, and I will now turn it over to Judge Barbara Canales. Thank you.
El condado de Nueces ya ha confirmado los 3 primeros casos con la variante Omicron. Los pacientes se encontraban completamente vacunados, pero no tenían su vacuna de refuerzo. Aunque la variante Omicron es nueva, los CDC continúan recomendando utilizar las vacunas para prevenir contagios o enfermarse seriamente. Se le pide vacunarse completamente y obtener su refuerzo. 6 meses después de la vacuna Moderna, 5 meses después de la vacuna Pfizer y 2 meses después de la vacuna Johnson & Johnson. En solo 4 días, en lo que va del año, hemos rebasado todos los casos positivos reportados en el mes de diciembre. El día de ayer le reportamos 960 casos positivos tan solo en un día. El rango de edades que reportó el mayor número de casos fue de entre 19 a 29 años, aunque se estima que los niños en edad escolar va a ser la edad de la mayoría de los casos positivos que se estima para casos futuros. Los casos semanales van en aumento a pesar de haber tenido una baja significativa desde mediados del mes de septiembre. El número de fallecimientos total reportado en el condado de Nueces es de 1,313 personas. Las hospitalizaciones han aumentado. Actualmente se encuentran 78 personas hospitalizadas. 21 de ellas se encuentran en la unidad de cuidados intensivos. En cuanto a la influenza, también los casos han aumentado en comparación al año pasado. Es importante que reciba su vacuna contra la influenza para evitar también enfermarse del flu. La variante Omicron se ha extendido por todo el país. Ahora representa el 95% de todos los casos nuevos en los Estados Unidos. Ayer se confirmaron 960 casos positivos aquí en el condado de Nueces, la mayor cantidad en un día desde que comenzó la pandemia. La variante parece ser muy transmisible. Hemos visto un aumento dramático en los casos de COVID-19 aquí en el condado, con un promedio de 65 casos por día en diciembre a 532 casos por día en los primeros 4 días de enero. A medida de que se propaga la variante Omicron, más niños terminan en el hospital. Durante la semana de Navidad hubo un aumento del 66% en los niños ingresados en el hospital con respecto a la semana anterior. Las nuevas normas de los CDC han cambiado. Si resultó positivo al COVID, se le pide aislarse por 5 días, pero si ha estado expuesto a una persona positiva al virus, se le pide utilizar su cubrebocas por 10 días y se haga la prueba después de 5 días. Si no está vacunado y ha estado expuesto, se le pide estar aislado por 5 días y utilizar su cubrebocas por 5 días adicionales. En cuanto a las clínicas disponibles para obtener la vacuna, estas se encuentran en el Centro Comercial La Palmera, en el Centro para Adultos Mayores de Greenwood, en los outlets en Robestown, en Physicians West, en el 2601 de Hospital Boulevard, en la Casa de Corte del Condado de Nueces y aquí mismo en el Ayuntamiento de la ciudad de Corpus Christi. Las pruebas de detección de COVID. Las pruebas se van a realizar y se continúan realizando en el antiguo Hospital Memorial, todos los días de la semana, de lunes a sábado, de 9 de la mañana a 6 de la tarde. Y el día de mañana se va a realizar una clínica especial de detección del COVID en el Centro de Exposición Richard Borchardt, de las 9 de la mañana a las 6 de la tarde. Estas pruebas son gratis para el público. Se ha demostrado que Regeneron es ineficaz para la variante Omicron y ya no se va a utilizar para tratar COVID. Sotrovimab ha sido aprobado y probado para combatir la variante Omicron. Suministros limitados disponibles hasta mediados o finales de enero. En cuanto a las píldoras Merck y Pfizer, ya fueron aprobadas recientemente, ahora están disponibles en Texas. Los medicamentos deben ser recetados por un proveedor de atención médica. Le queremos recordar a todos los residentes que se le pide no ingresar a la clínica de vacunación del Distrito de Salud ni a un consultorio del doctor si usted es positivo al COVID. Se le pide llamar primero. Se le recuerda que no se están realizando pruebas en nuestras clínicas de vacunación. Y si necesita su tarjeta de vacunación, comuníquese con el Distrito de Salud al 826-7200.
Barbara Canales, Nueces County Judge. I have just concluded court just moments ago. I've got some prepared remarks, and then I'm going to give you a few updates that I think are important as it relates to our COVID-19 emergency from the perspective of emergency management. First, we are in a new year. It is 2022, and we're in the middle of a very familiar scenario with a few new twists. I almost feel like that famous line, "Mamma mia, here we go again." As you know, we have been dealing with Omicron, and this variant of the coronavirus is incredibly transmissible and contagious, as you've just heard our Director of Public Health articulate. And we have to remind ourselves how fast things change. It was just after Thanksgiving that this particular variant entered our country. We know how fast it spreads. This is not up for debate. We had 960 cases day before yesterday. I think I just saw we had over 630. These are the types of numbers that make everybody in emergency management shake, because even though it does not have the rate of death, thank God, that Delta did, it still has the potential for chaos in our economy, chaos in our workforce, chaos in our urgent care clinics, chaos in our ER. And this diminishment of workforce hurts all of us. So we know that after today that Omicron is not only present in Nueces County, but that it displaces all other variants. So there's no reason that we have to discuss whether or not is it or is it not Omicron. It's Omicron. CDC reported that 95% of the COVID cases are now Omicron in our country. So, as I stated earlier, it's a little bit of a mixed blessing, but the word blessing seems bizarre to me anyway, but I try to find all good things in all difficult corners. And that is that of the strains that could be dominant, Omicron appears to produce these milder symptoms for a lot of people, but not all people. And so having a virus that spreads easily but produces milder symptoms is this mixed messaging, mixed blessing that I'm talking about. And while COVID can be mild for many, I know personally, by talking to so many affected folks every day, that there are some that do experience those tougher, more severe symptoms, the ones that get you to the hospital, the ones that get you to ICU, the ones that sometimes make the vent your only method of survival. And that means that Omicron variant has the potential to be as bad as any other previous variant. So every day, my job is to make sure that we get public health the resources they need. It's our job in emergency management to make sure that beyond the resources and the logistics support and the public messaging support, that we're getting our hospitals the staff they need by pushing up those STAR requests for those additional 100 healthcare workers. We're closely monitoring the capacity of our hospitals, particularly that of ICU. And I haven't looked at it because I said I just came from court, but I know last night, I think we had 78 people in the hospital and somewhere around 20 in ICU, 2021. And you say, well, gosh, that doesn't seem anywhere as bad as what it was last July. You're right. But last July, we had 30% more capacity than we have today. And that has to do with staffing challenges. So let me remind you what has already been said. The best way to stay out of the hospital is to get vaccinated, because we know vaccines work. They help prevent getting COVID, they reduce the symptoms if you do get COVID, and they shorten the duration of illness if you've got it as well. And this really new breaking news that the CDC took action this week to expand vaccine availability. for those that are in those ages between 12 and 15 is really positive, I think. And also this the shortening of the time between the completion of the primary vaccination for Pfizer and the booster to 5 months, which was at 6 months before. We love that because that gives people more chances who want the vaccine to go and get it. And it also allows for a third primary series dose for those immunocompromised children from 5 to 11. That's a really important age. I just saw that huge uptick in our children's positivity today. Guys, that means something. Pay attention to what these things mean because it has a domino effect for us. And by the way, all of this was completely foreseeable. We've been saying this since Thanksgiving, and we've also been warning before Thanksgiving that our new winter season variant most likely would come. And of course, we always have the typical winter flu to worry about. So, having said the good thing that CDC did last week and this week, they did something great today, and I know we've talked about it, but expanding that single booster dose to those 12 to 15-year-olds, I do expect our La Palmera Mall to be busy. I want those kids in that age of 12 to 15 to know when it's their turn, hey, go to the place you always hang out at, man. Go to La Palmera Mall and get that vaccine. Director Rodriguez obviously gave you all the details, and although I caught the middle of it, what I want you to know is your public health district is ready. It's ready, it's prepared, it's been in action throughout this entire pandemic, and today, tomorrow, is no difference. So going back to, our summary, prevention is our best option. I want to make sure that you guys hear this loud and clear, that the majority of virus transmission, according to the experts, occurs early in the course of illness. And so that's the time you really want to be extra careful to mind those rules, particularly those 2 to 3 days after. Please pay close attention to your health. And if you develop symptoms, don't assume that it's just something in the air or winter or, maybe you're tired. Get tested. That way you can isolate and protect others immediately. And I know, because I'm kind of like everybody else, we always want to tough it out. I've even joked that, I'm too, I haven't gotten, okay, I've got to find some good wood. I have not had COVID-19 yet, but I've had a lot of exposure over the last 3 years. And so we always think we're tough, but I test all the time, even if my symptoms are slight, because I want to protect everybody around me, and I know you do too. So, what are our big 3 takeaways? Get vaccinated, get boosted, watch your health, isolate if you have symptoms. And I've always said that I love our new year because it's always filled with such new hope and opportunity. But when I'm at this podium, I always say the same thing. Hope is not a strategy. Use the tools we have to fight this virus and know that nothing has changed. We're in this fight still together. So please join the fight, because I do believe together we can win. Those are my prepared remarks that I had for us today. I do want to give you a quick update about Commissioner's Court on 2 important matters. One is the COVID clinic. Annette, today in Commissioner's Court, the court approved 6 more months of the COVID clinic, and we'll reevaluate after that. Man, am I pumped about that. Thank you, Amistad. Thank you, all the doctors, Jacqueline Phillips, all of her nurses, all of the people that make the Amistad clinic, the COVID clinic, the partnership with the county possible. And thank you to Public Health for supporting it before this contract, because the previous contract was signed by the health district. What does this do for you? It gives you a free clinic to access free COVID health care, including laboratory, including x-ray, therapeutics, if that is what's called for. And within, that same day that you call, you're going to get a telehealth call back to assess you. Now, I've hoped I've remembered the number correctly. Maggie, flag me down if I'm wrong, but I believe the number is 361-826-8019. That's our COVID clinic. And thanks to Commissioners Court, it's going to keep on working for you, the residents of Nueces County. Very, very proud about that. We're also still going to be, as I said, at La Palmera Mall. That contract was extended through March. And of course, we're going to keep reevaluating. We actually have military personnel there through April to help assist us. All good things related to COVID-19. I also want to say that I'm proud to say that today the Commissioners Court included the 10% premium pay for the Public Health District county employees. That was something that we wanted to do, and even more important for the director and for her staff. We've also said we're going to bring back the potential of doing more, getting to that 20% mark. So we left that up for evaluation, but we set the floor at 10% and the ceiling at 20%. They deserve it. They have worked hard, and they have protected us. So that's a really good thing that happened today in Commissioners Court. Finally, I would also say that at the very end, and it kind of came out of executive session and was just sort of hitting the wire right now, and that is the court has said January 18th, which was the day that the City Council said they wanted to withdraw from the health district, is too soon. We are in the middle of a global pandemic. We're in the middle of a major surge in our backyard, and we need to make certain that we're doing everything we can to put all focus on that, on our response. And so we have said March is a better day to focus on getting this agreement in its good framework for our future. And March doesn't mean that's when the transition will happen. It means that we can't live with January 18th. And we've also set a special meeting aside. I think it'll be January the 12th, if I recall, in the morning, so that we can talk about the framework the city has presented to us. So we're still working on that, but I'm here as the emergency manager to tell you that what we need to be 100% focused on is this response. We have boosted, literally, testing. I am so happy and proud to tell you that when your residents need testing, we're here to deliver. And we did that during the holidays. So we're going to expand, as you heard, to Aviator Stadium on Thursday at Richard Borchard Fairgrounds. We're going to extend to Saturday hours at Memorial. And today I instructed my emergency management team to reach out to Port Aransas because we need to tackle that geographic area as well for testing. We have already solidified the opportunity to have Texas A&M also host a testing facility because we know when those kids come back to school from winter break, that's going to be a need as well. All of these actions are to prepare for the overwhelming response that high transmissibility of this variant has caused. And we're doing that to make sure that our residents have a place to go, that they're not paying $150 for a rapid test, that they know that they can get a free test with their public health district. So thank you to all those who make that possible. I just heard it said that, it's the hours are 9 a.m. to 6 p.m. But my friends, let me tell you, in order to produce a 9 a.m. to 6 p.m., you're working starting at 5 a.m. You're working the day before to work on registration and preparedness on the resources. You're making sure that everything is in place so that if you're that car at 9 a.m., you can be taken care of. Or if it's 6:05, if you just roll in, like a military personnel did yesterday, we don't say, hey man, sorry, we're closed. We stay. So I just want you to know that that's what it takes when we say together we can win. That's what I mean. So thank you to all who have supported public health, because I promise you, every day they're supporting you. Thank you.
Mientras comenzamos con un año nuevo, también lidiamos con la variante Omicron del coronavirus, el cual llegó a los Estados Unidos después del Día de Acción de Gracias. Esta variante se transmite rápidamente. Ahora el 95% de los casos es de la variante Omicron. La buena noticia es que siendo una variante predominante, también es la variante que ha demostrado tener síntomas más moderados, por lo que hemos y continuaremos monitoreando la capacidad con la que cuentan nuestros hospitales. La mejor manera de estar alejados del hospital es mediante la vacunación, la cual va a reducir sus síntomas en caso de contagiarse con el virus y también podrá aminorar el tiempo de la enfermedad. Esta semana los CDC tomaron acción para expandir la disponibilidad de las vacunas para niños entre 12 a 15 años. Ahora las vacunas de refuerzo de Pfizer se podrán administrar a los 5 meses de haber obtenido la vacuna original, comparado a los 6 meses antes de que se había recomendado. También se ha aprobado una tercera dosis para personas con sistema inmune débil en niños entre 5 a 11 años. Lo que sabemos es que la prevención es la mejor opción. Vacúnese, utilice cubrebocas y lave sus manos con frecuencia. También sabemos que la mayoría de la transmisión del virus ocurre durante los 2 primeros días de la presencia de los síntomas, así que ponga atención a su salud, aíslese si cuenta con síntomas y hágase la prueba. Tome todas sus medidas si resulta positivo. La Corte de Comisionados aprobó el día de hoy 6 meses adicionales para la clínica COVID ubicada en el Centro Amistad. El número de esa clínica es el 826-8019. La clínica es gratuita y ofrece varios servicios para las personas que resultan positivas con el virus. También el día de hoy, durante esa junta, se determinó en la Corte que el 18 de enero es muy pronto para la separación del Distrito de Salud y sugerimos que sea en marzo, pero no en enero. El 12 de enero tendremos una junta para poder tocar ese tema.
Right, good evening, everybody. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Texas A&M University Corpus Christi Informatics and Modeling Team. This is your weekly pandemic report. We have 2 objectives: to address your concerns and questions, number 1, about COVID, and 2, to enable evidence-based decision-making on behalf of our local leaders. We'll get right into the projections. I think everybody's aware that the cases started spiking up over the past few days, and there are very few changes to the projections this week versus last week. I incorporated new estimates of susceptibility to the Omicron variant, but essentially we have 2 scenarios. The red scenario is what happens if we just don't do anything and go about our normal lives, and that results in over 3,000 confirmed cases in the coastal bend at the peak, which is extremely high, more than all the other peaks stacked on top of each other. The alternative is that we try to do something, and this isn't as good as we can do, but I based on what we've done in the past. And if we do as good as we have in the past, we should be able to crush this curve down to something much lower. And if we crush the curve down to something much lower, then less people get hospitalized, and it's better for all of us. You don't see the blue scenario here because it's underneath the yellow or the orange scenario. They have exactly the same dynamics when it comes to cases. The difference with the blue scenario is hospitalization rate, so it has no impact on the number of cases. Okay, the next projection shows you the number of inpatients presently, and we've seen a jump in the last day or 2 here, where we're up to 129 at the last data point that I have in the number of COVID patients that are hospitalized in the coastal bend. And unfortunately, right now, the data is tracking the red and the yellow curves and not the blue curve, which was if we get a lower hospitalization rate or a more optimistic hospitalization rate than even was projected with these red and yellow curves. But thus far, it doesn't look like that blue curve is going to happen. And it looks like we're on the yellow or red trajectory right now. Time will tell, but hospitalizations are increasing exponentially now. They're not just increasing linearly like they had been last week. In the ICU, we see the same jump. It's not a big jump because we're only up to 30 people in the ICU with COVID. I say only 30 because in the past we've had well over 100 people in the ICU with COVID in previous peaks. But again, it's tracking the yellow or the red curve and not the blue curve. So I encourage everybody to wear your mask, to do things to avoid transmitting COVID. And if we do that, we can have a real impact on what happens for our hospitals. And one of the reasons why that's so important right now is our hospital capacity is quite low. It's lower than it was at the beginning of the Delta wave, it's lower than it was during the Alpha wave, and it's lower than it was during the original wave that we experienced in the summer of 2020. And so right now the capacity is under 1,250 staffed beds. And if you look at the vacancy, it's down at 12%. And so that means that 12% of all staffed beds are open to receive additional patients. And that is quite low compared to previous peaks that we've gone through and waves of COVID. So even though Omicron is less virulent and less people are going to the hospital, there's less beds for them in the hospital and less staff to take care of them. And that's the thing that we're very concerned about right now and why we want or encouraging people to do something about it. So in summary, the Omicron wave, it's not just starting, it's started, it's here, right? You know, the cases have jumped way up in the past few days. Cases and hospitalizations have gone exponential. And so now the only question is how high will they go? Projections for the peak cases and hospitalizations are reduced by masking, by social distancing, by isolating if you're exposed to COVID or if you test positive, all those things that we've done in the past to control COVID, it still works. And that's the consistent thing here. We're not changing our recommendations on how to combat this. Obviously, you want to get boosted. If you're boosted, you're much less likely to go to the hospital. You're much less likely to contract COVID in the first place. And the important point is that our decisions, we have control over this. We can control exactly how high this peak goes. But it takes sacrifice and it takes effort on our part. Nothing comes easy. Lastly, the hospital vacancy is low, and that's the biggest concern here. And our healthcare workers, they're tired. They've gone through 2 years of this. I know our public healthcare workers are tired. Imagine those people on the front lines there in the hospitals working double shifts all the time, 12-hour days, getting not very much sleep for 2 years on end, and now there's even fewer people there to help with the load. So we want to do these people in our community a favor, and we want to pay them our gratitude and wear a mask and get boosted and try to help them come back to some sense of normalcy in their lives. So lastly, to combat Omicron, it's simple. Avoid crowded areas. Avoid situations where you might become infected or transmit it. 2, put on a mask. Masks work. They're 80 to 90% effective. Wear one of these KN95 masks. It's pretty comfortable. You can hear me pretty well, I think, through the microphone, so it's not that big of a deal. Get vaccinated. Get the booster when it's 5 months after you had the Moderna or Pfizer. 5 months after the Pfizer, 6 months after the Moderna, and 2 months after the Johnson & Johnson. I can see the public health director nodding her head. And that helps protect you from getting COVID again or in the first time, but there are more people now getting COVID again than we've seen in the past. And lastly, isolate when you've been exposed or when you test positive. Get tested if you feel sick, and if you are positive, don't go into work. I heard a story this week about a teacher who wanted to keep going in even though they were sick because they don't like missing class and they were short-staffed, but that's not the way to help the staffing get, to keep up with teaching the kids, because even more people will get it, the staff will get shorter. So make sure you're doing your part to reduce the transmission of COVID. With that, we'll go to a translation, and then the public health director, I think, will address any additional questions that there might be. Thank you.
De acuerdo a las proyecciones, si los residentes no toman ninguna acción contra el COVID, los casos positivos diarios pudieran ascender a más de 3,000 en solo unos días. Los pacientes en el hospital ascenderían a alrededor de 500 y más de 100 en unidades de cuidados intensivos. La capacidad con la que cuentan los hospitales para atender a nuevos pacientes ha disminuido a menos del 30% desde el comienzo de la ola de casos por la variante Delta. Las vacantes en los hospitales del área es del 12%. Los casos pico y las hospitalizaciones proyectadas se pueden reducir mediante la utilización de cubrebocas, así como de otras medidas sanitarias. Las decisiones que tomemos afectarán el resultado de la transmisión y contagio de esta variante. Se le pide evitar ir a lugares con grandes concentraciones de personas. Se le pide utilizar un cubrebocas para evitar la exposición directa al virus. Las vacunas reducirán los síntomas severos si se contagia con el virus, mientras que las vacunas de refuerzo le darán más protección que una sola vacuna. Si muestra síntomas, aíslese de las personas y hágase la prueba. Si resulta positivo, tome todas sus medidas para evitar transmitir el virus, así como tratamientos para combatirlo.
Are there any questions? That concludes our presser, the first one for the year 2022. So we will be here again next Wednesday. Thank you.